IVF can be an extremely confusing treatment, especially for patients. And doctors love using jargon and complexifying things to make it appear that what they're doing is very complicated. And perhaps, obviously, if it's complicated, it's got to be expensive. And unfortunately, in India, patients don't ask too many questions and they don't do enough homework to find out what's happening. And in this video, I'm going to talk to you about Teratozoospermia. And if you want to find out what Teratozoospermia means and what to do about it and what the treatment options are, please watch the entire video and you will learn enough so that no doctor will be able to take you for a ride. I'm Dr. Malpani. I run an IVF clinic at www.drmalpani.com and I've been doing this for many years and I'm good at what I do. So let's look at this word. Now, the first test for an infertile couple is the man's sperm count. Remember, always test the man first because it's a simple, cheap test. The woman's testing should be done afterwards. Now, a semen analysis is a simple test and it's not very expensive. But because it's so simple, it's very simple to do badly. And tragically, lots of labs will do it badly. A lot of these labs don't even know the basics like what a normal sperm count is. They still write reports normal and in brackets between 60 million to 150 million. Ridiculous. Everyone knows that a normal sperm count is more than 15 million, but obviously no one's told these labs that. But when you look at this form, the sperm analysis report, you will notice that the lab technician is supposed to check the count, the motility, and the shape of the sperms, what's called the morphology. And it's very common to have abnormal sperms, and that's absolutely fine because there are just so many sperms constantly being produced in the testis that even in a fertile man, the majority of sperms will be abnormally shaped. But when the number of abnormal forms is extremely high, the medical word for that is called Teratozoospermia. Terato means monster. You may have come across this word when you remember that a drug which causes birth defects, for example, thalidomide, is called a teratogen, which means it creates a birth defect. That's why the word terato here means that it's a defective shaped sperm. Lots of sperms are defectively shaped and that's fine. And even if 60-70% of sperms are abnormally shaped or formed, that does not affect your fertility. But that's not something most patients know. So when they read a report and say, oh, I've got 60% abnormal forms, they get petrified. So, oh, that's the reason I'm not getting pregnant. And sadly, the doctor, the treating gynecologist doesn't know any better at all. And he will reinforce that opinion. And to add insult to injury, he will then end up treating these actually fertile men for their abnormal sperm forms. The root of the problem is actually the lab. The lab technician does not know how to check sperm morphology. It's not easy to test for sperm morphology. Ideally, what you need to do is you need to stain the sperms on a slide using special stains and then check the shape of each individual sperm so that you counted 100. And then you can check the tails, the shape of the head, whether it's oval and so on. And it's fairly detailed. But most labs don't know how to do this. It's time consuming, it's expensive. So a lot of them will take shortcuts and just write whatever they like. And this obviously hurts both ways because then there are guys who actually are infertile because of teratozoospermia, but because the lab hasn't done the sperm morphology test properly, they miss that diagnosis. But much more commonly, they misreport a sperm sample as having abnormal forms when actually it doesn't. Now, because it's been such a complex problem, there have been special criteria laid down. For example, there are called Kruger criteria for strict morphology, which means only a perfect sperm with no abnormalities is considered to be normal forms. And in this situation, fertile men will have as low as just 4% normal form, which means it's perfectly okay for a man to have up to 96% abnormal forms when you're using strict morphology. But most technicians don't know what strict morphology is. Most of them don't bother. Most of them are just very casual and write anything. You can't even trust these reports. And that's a bit of a mess. The bottom line is don't go to an unreliable lab. Don't take shortcuts. Don't go to the nearby lab just because he happens to do a semen analysis. Go to a reliable lab if you want your testing done. And if it's been reported as abnormal, insist that they do a morphology test with a stained slide, so that you can actually reconfirm whether this is correct or not. Now, most of the time, occasional abnormal sperms will have no impact whatsoever, but there will, very rarely, be men who only have 1% normal sperms or 2% normal sperms. It's this very small group which is called Teratozoospermic infertility. Fortunately, like I said, it's not very common, but when it's picked up, it's really important. But the trouble with these abnormally shaped sperms is they don't function properly. They're not capable of fertilizing the egg in the IVF lab. So they can't get their wives pregnant in the bedroom. They can't get their wives pregnant after IUI. And this is a diagnosis which is easily missed because their count is normal and the motility is normal, but it's their morphology which is abnormal, but it's not being tested properly. And this is often the couple where you have total failed fertilization. Even with IVF, the sperms don't fertilize the egg because they're abnormally shaped. And you only find this out the hard way. And the perfect treatment for men with abnormally shaped sperm or with Teratozoospermia with less than 4% normal forms by strict morphology is called ICSI or ICSI or intracytoplasmic sperm injection, where we do in the IVF lab what the sperm is not capable for doing for itself, which means the embryologist takes the eggs we give after the egg collection, strips them so he can hold the egg under a micro manipulator, very large instrument which magnifies it, holds the egg, and then takes a single sperm and puts that single sperm inside the egg to fertilize it. And the good news is, with ICSI, the fertilization rate with teratozoospermic sperms is very, very high, as long as the wife is young and she has good quality eggs. Now, even within Teratozoospermia, there are lots of different varieties, and there is an uncommon form which is called Globozoospermia. Now, this is actually very easy to diagnose provided the test for the sperm morphology is done properly, because what happens is in these people, the sperm head doesn't have an acrosomal cap, which means it's no longer oval and it's round, and that's why it's called Globozoospermia. Now, for these men, even if you do ICSI, you still have total failed fertilization after ICSI. And in fact, often the diagnosis is made only when the doctor realizes, oh, we didn't get any fertilization at all even after doing ICSI. And that's when they go back and check the slides and check the morphology and find out that the man had Globozoospermia. And that was the reason. The good news is it's possible to treat these men with doing ICSI with assisted oocyte activation. Assisted oocyte activation means we add a special chemical called a calcium ionophore, which allows us to then do the ICSI in such a way that even though the sperm does not have an acrosomal cap, we can still achieve fertilization. Getting a little confused? All this is getting too much for you? I completely understand. I'm not trying to make you an IVF doctor. Please understand. I understand you're a patient and you'd rather not care about these details, but you can't afford to leave everything up to the doctor. As long as you have a good doctor, you're fine. But if you end up with a bad doctor, you're in serious trouble. You'll end up wasting time, money, energy, and by that time your wife will be so old that even if you go to a good IVF doctor like me, there'll be very little we'll be able to do for you. So the moral of the lesson is, do your homework. Don't assume you're not going to understand anything. If the doctor refuses to explain, that's a red flag. There's tons of information available on our website, which is www.drmalpani.com. And if you're confused, please go to our website and send me an email. I reply promptly, no strings attached. It's a free service. I believe in karma, and if I can help you to have a baby, I'll be the happiest doctor. Look forward to seeing you at www.drmalpani.com and look forward to helping you to have a baby.